A United Nations report has revealed that in Nigeria, up to 8 million women that get pregnant annually, 2 out of 3 don't have access to prevention of mother-to-child HIV transmission services during antenatal care. Now, Nigeria is the most populous country in Africa with one of the biggest economies too. And if there is one thing it greatly wants to achieve, it would be ending AIDS in children. Now, Yahya Jammeh again has the details of that in this report.
For the vast majority of women who get pregnant in Nigeria annually, it's either they deliver their child at home or they don't have access to a clinic or health services. The United Nations says Nigeria's vertical transmission rate is 25%. That is when a mother passes on HIV to her child during pregnancy or while breastfeeding. This is the highest in the region. As a result, babies are born with HIV and don't take life-saving treatment, that is daily medicine, to surpass the virus, meaning that a person can live a long. This report, just as the world commemorates World AIDS Day in remembrance of those who died of the virus as well as survivors. Currently, only 31% of children and adolescents aged 0 to 19 living with HIV in Nigeria are taking antiretroviral therapy against 90% of adults. Grace Amudu, 28, was born with HIV, and although she had a difficult time adjusting to her status at age 7, she is grateful for the community support she got from other women living with HIV. She gave birth to 2 children who are both HIV negative.
I knew my status, I knew I was HIV positive, and I told myself that I would not want to bring any child to the world who also be HIV positive. So what I first of all did, I started my medication, and I adhered to the prescription of what the doctor told me.
This is my son. He's 7 years old, and yeah, that's my daughter. She's 8 months old. Yeah, they are HIV negative.
I'm actually a community pharmacist where we go to the hospital, we get drugs from the hospital and give to the patients who are maybe they are not able to come to the hospital to access their drugs due to maybe they don't have transport fare, or they are far away, or due to the stigma in the hospital. So we take these drugs down to their doorstep and give it to them.
Stella Ibe, 45, lives with HIV and is a part-time public health officer at the health center on the outskirts of Abuja. She counsels pregnant mothers who lived with HIV as well as family members.
I become a mentor mother under Institute of Human Virology Nigeria, where I use my experience, my challenges and my testimony to eradicate mother-to-child transmission. As I am a woman living with HIV, I know the pains of being positive. I know the challenges, and I don't want people to pass through what I passed through in the area of stigma.
One of the health workers said that certain women are still giving birth at home or going to traditional birth attendants. She, however, said that they make sure to find these women and give the healthcare attention they need.
A lot of them are in birth homes, they go to traditional birth attendants, and many deliver at home and receive services at home. And so we have got a new strategy which aims to ensure that we can find them where they are, ensure that they are treated, ensure that we can find them first, ensure that we can test them, link them into treatment, and count every single one that has gained access to care.
For the past 2 years, Nigeria has embarked on mapping and finding as many pregnant women as possible and linking them to HIV services, whether at home and/or via community outreach, as part of a new strategy to stop infections and also increase access to treatment if needed. Worldwide, 1.7 million children from 0 to 14 years are living with HIV, with 160,000 children infected last year. Almost half of new HIV infections in children globally are due to HIV-positive women not being diagnosed and not being started on treatment. This is also due to lack of access to HIV prevention and treatment among pregnant and breastfeeding mothers. Reporting for Eyeafrica News, I am Yahya Jammeh.